We are back.
Did you know we actually have guidelines that help guide people who've given birth back to exercise?
Actually, it is kind of shocking because we didn't for a long time.
For a very long time.
So in 2019, a set of guidelines came out. And they are just guidelines. They're not like they're not 100%. But we want to talk about that today because we are very happy to have them now. Yeah.
Yeah, because I think it gives too, if you have people that aren't able to access medical care, pelvic floor physiotherapy, you can at least give them like a structure that we say, based on the best available evidence, this is the information I can give you.
We need you to pass these tests that we're going to give you, and if you can pass those tests, we think it's appropriate for you to do a trial of return to higher intensity
exercise.
Yeah.
So let's talk about them.
Okay, so the first kind of set of tests are pelvic floor muscle tests, right? So they're looking for things like, has your strength, do you know how to use your pelvic floor? Mm-hmm. Has your strength come back? Has your coordination come back? A lot of people don't think about coordination, they just think about Kegel. Like you need to be able to do it at a certain speed, you need to be able to do it with correct timing. When you cough or sneeze, you should be able to Kegel. If you're talking about landing, a repeated like run or a squat jump, then you need to have the coordination for that. And then endurance. Yep. Endurance of the pelvic floor. So certainly if you're looking at running, that's an endurance sport. You need to have a certain amount of tone that can be held kind of reflexively during your run.
And obviously, like that's something that needs to be checked by a pelvic floor physio. But again, we do have guidelines, and they said that if you can't access that, generally no return to high impact exercise for 12 to 16 weeks postpartum.
Yeah.
So 3 to 4 month period.
Yeah.
Again, that's a guideline. If you see a pelvic floor physio or your medical provider and they've checked these things, I do see people who are able to go back earlier.
I personally sent people back much earlier, and I've personally seen people who at 2 years still weren't ready.
Exactly. So I think that's the point. It's just a guideline, but I always say to people too, like if you are not in a rush to get back to high impact exercise, let's give your tissue that time. But then there's also people who are like, I have a goal.
Well, and sometimes like for mental health reasons they want to get back, but you're right, sometimes they got a deadline of like a marathon that they want to get in, and they're a competitive athlete and they need to get back into sport for competitive seasons. So there's lots of things that we can do to help that, but that's a different discussion.
Lower body strength.
Lower body strength. Okay, so then there's a test for lower body strength, and really it's focusing on hips, glutes, calf muscles, quadriceps.
And can I just say something?
Please.
Even if you were active, because people being like, I worked out 40 weeks of pregnancy. I'm like, fantastic. That's so good for you. So good for the baby. It's going to make your transition back to exercise a little bit easier. At some point, though, during your pregnancy or the postpartum period, you probably were not at your typical level of activity. Mm-hmm. And that's okay. But there's something called the principle of reversibility. And unfortunately, the minute we stop the intensity of exercise we're doing or the type of exercises we're doing, we start to slowly trend back to an on-train state. Okay? That takes a little while, but it does start to happen quite rapidly. The other thing, major musculoskeletal changes in your posture, the length of muscles, because you had to counterbalance a growing human.
Yep.
For 10 months, and then that changes very rapidly postpartum. So again, another huge musculoskeletal change going into the postpartum period.
Yep.
So I think that the fact that we think we can just jump right back into what we were doing, I like to just say, like, let's be cautious about this and monitor for some things.
Yeah.
Lower body tends to be really impacted by a lot of those MSK changes as well.
Well, even like the pelvic shift that you see in the bony structure, and so the muscles are just functioning differently, right?
Because they're different lengths.
Yeah. Plus your balance has been shifted. So like there's a whole number of things that are affecting this. And I think too that the people who are very athletic, very like sports and exercise minded during pregnancy are so shocked. If like you did everything right, you didn't do anything wrong.
No.
You didn't do anything wrong, and you still might need this grace period.
Your body did exactly what it was supposed to do.
Yeah.
It just needs a little bit of time.
Yeah.
Also, bodies are really good. Like physiologically, humans, like your body is lazy. Like it's gonna find the easiest way to do things. And so, if you are having like pelvic changes postpartum or during pregnancy, which happen, like your body's going to continue to want to train in that position. And so it's important to kind of do some stuff to help get back to what how your body was functioning and how those muscles were functioning before you.
Right. So we see people that will pick up these kind of interesting habits, and I'll see them in menopause, and if no one's corrected them, then they've been using this habit for a long period of time, right? Like holding their breath or gripping with their abs to do movements, and using maybe not all of the glutes that they should be using, like very, very specific movement patterns that they kind of get stuck into. And we want a variety of movement. We want lots of availability, that you have options for using different muscles and different movements.
Yeah. And people say to me, I'm getting off track right now,
That's okay.
but they'll say to me, like, should I like move like this or breathe like this all the time? I say, no, absolutely not. But you should have it available to you.
Yeah.
And so if it's not available to you, then you're going to do some funky things when you're working out or you're getting back to your fitness. So yeah.
So it doesn't need to be as rigid as you think.
No.
But if you're having symptoms, then we encourage you to get checked. And we do think that there's a really good reason to go back to basics in the early postpartum time frame.
And so bringing that all back to the lower body strength. So lower body obviously is really important for how we manage ground reaction force. So how are we absorbing forces through our lower body when we go back to impact or higher intensity exercise? And so in this paper, in the guidelines, they actually give us a checklist, which we will share with you guys, that you should be able to pass fairly easily before we start to think about impacting again.
Yeah.
So think about jumping, burpees, jumping jacks,
squat jumps,
running,
yeah,
everything that's like higher impact. We do like to see that lower body strength kind of meet the guidelines.
Because your leg is like the shock absorber,
100%.
right? So if your leg can't absorb that impact, then that impact is going to go up into the pelvis, and that's where we will see the pelvic floor symptoms. So we need strong legs.
And I was just going to say something about, if you're going to run, you're on one leg or the other. 50% of the time you're on your right leg, 50% of the time. Yeah, it is. It's single leg activity. And so it's really important that you kind of get through this checklist before you start. Not to say you can't start running again, but you want to be working towards building strength in this checklist before you, get back to the high intensity exercise.
Helps reduce pelvic floor symptoms, helps reduce risk of injury in the lower body. That was really wordy. Okay. All right, bye.
Ask us questions.
Yeah.